all of our staff at the special health accommodation, those who are managing the facility, those wonderful clinicians who are looking after our patients, you're doing a fabulous job and we're so proud of you.
I've also been filled with such enormous pride, and I have even been astonished over the last several months of just how amazing people have been in just coming together, being asked to work in ways that are very different to the way they would normally work, asking people to work outside their comfort zones and to adapt. But I think the pandemic has given us an opportunity, I think, to think a little bit differently and in a more sort of flexible, adaptive way. And I think it's been really amazing to see what can be created sometimes when you kind of do that.
I think with the strong leadership that we've had from the chief executive down, and the support and the support from the staff on the ground, you know, working up together, everybody's opinion is valid and is accepted and discussed, and everyone has a place to play. And I think that's been shown within the setting up of the structure and the ongoing working. It doesn't matter who you are, you play a vital part in keeping the operation functioning.
Special health accommodation has been really the best thing in my mind that New South Wales Health and Sydney Local Health District could have established.
Special health accommodation is accommodation that is designed for returned travellers from overseas or COVID positive patients, and are entirely looked after by New South Wales Health or Sydney Local Health District.
You know, special health accommodation is kind of a field hospital framed within a hotel. So we've got, you know, specialised healthcare, whether that's allied health or dietetics or nurses or RPA virtual, which is obviously remote, who every day call in and check on people's welfare and all the needs that they have.
The special health accommodation is a really critical public health measure because it ensures that patients with COVID-19 are cared for while also stopping the spread of COVID-19 in the community.
I'm the allied health team leader, so I'm an occupational therapist by profession, and we work as part of the allied health response team here in SHA, and it's providing all allied health support to patients while they're here.
As an accommodation assistant, I'm responsible for taking deliveries and supplies up to our patients in quarantine, and also doing stock take, ordering, and all of the admin side of things as well.
The best part of this job, and I've sort of been saying this from the beginning, is that I've gotten to sort of work in a very different team environment than what you would normally get in the hospital. I've gotten to work more closely with some allied health professionals, and obviously the Qantas staff have been absolutely wonderful, and all sorts of different people have been pulled from all over the LHD.
The best part of this job, being able to fulfil a vital role and self of giving back to the community.
I do cleaning, so I supervise terminal cleaning and cleaning of operating theatres, and going from that to cleaning hotel rooms has been quite a challenge, because a lot of the cleaners we have here are hotel cleaners, so their background cleaning isn't necessarily hospital cleaning, and that's where I come in. So I do a lot of the training, showing them how we do the cleaning and most importantly why we do it.
I'm the security manager for the site. I do most of the days here, so my main role is to manage my security team and to maintain that nobody leaves this hotel.
It gives me a great confidence that I can actually walk into those sites and do my duty as normal without any fear, and go back to my family, making sure that I'm not going to be passing them anything.
It's actually a really smooth process. It's very comfortable. I feel really good after it, so I'd strongly encourage everyone to do it.
I was just so overjoyed and overwhelmed that those who've protected all of us and welcome home Australians were the first ones to get the jab, and by that showing us the way forward, and I'm really excited by that.
To those staff, some of the unsung heroes of this pandemic who've been working so hard in hotel quarantine and at our borders, and of course our clinical staff who've been there day in, day out for a long time, working to protect our state from COVID-19.
A big thank you to everyone who's been involved in the impressive operation of the health hotel, the special health accommodation that has supported the quarantine program. I want to extend my appreciation for the care and compassion you show every day in dealing with people at a very vulnerable time in returning to this country.
I just want to take this opportunity to thank all of the staff who have made our hospital quarantine system, particularly our health hotels, just the outstanding quarantine system, in my view, in the country. I have heard nothing but amazing stories and thanks. I've had text messages, I've had emails from people who've been in those health hotels, and they have all reported the most amazing outcomes for themselves. They've told me just how nice each and every one of you were to them. So thank you. A big thank you from me as your Minister. You have made a huge difference in this 1 in 100 year pandemic. Again, thanks.
You guys have done a phenomenal job in providing care for our community. Well done and congratulations.
I'd like to take this opportunity to thank all the nursing staff within SHA for their commitment and dedication.
Thank you to our clinical and corporate support services. The way you've pulled together in a multidisciplinary team that has helped support all our staff and make sure that sites operate effectively has been tremendous to watch. To our Qantas staff who were redeployed, never thinking they may ever work in health, the way you've come on board and learned the job so quickly and managed to make such an effective difference to the way we operated is truly appreciated. Thank you.
I would like to thank all the SHA nursing team, both Concord and RPA nursing teams, and also our partnership within RPA Virtual. Thank you to all the staff.
The special health accommodation isn't just a milestone for the SHA team. The work that has been achieved has been a team effort from across Sydney Local Health District. On behalf of the team of SHA, I would like to extend a sincere thank you to all those services across Sydney Local Health District.
Thank you to all of you.
Thank you.